Good morning, Arlo with Battle Tested. Today we're going to talk about foam rolling the quadriceps or the anterior thighs. So from the hip bone to the knee, that's where we're going to roll on the front. We'll try and get the inside, the medial and lateral side also. So frequently people will come to me with lower back pain and or knee pain, and one of the first things that we address is quadricep and hip flexor tightness, and we find that that relieves the pain nearly every time. Depends what the issue is, obviously, but if it's just a chronic overuse type issue where they don't really have a reason, they don't know why it's hurting, and it just their lower back aches, especially around their sacrum and a little higher, or they're having knee pain, then by loosening up and breaking up adhesions in the fascia throughout the quadriceps and hip flexors, we can make a big impact on that. And the reason why, one of the reasons why, anyway, is as your hip flexors tighten, a lot of people will experience anterior pelvic tilt, where their pelvis will tilt forward, which also compresses the lower back, the spine in the lower back. So typically you'll have a cross pattern where if you have tight hip flexors, you also have tight lower back. That corresponds most of the time with weak abdominal muscles and weak glutes as well. So by strengthening the abdominals and the glutes, it will help, and by loosening the lower back and the quadriceps and hip flexors, then that will also help. So to roll the quadriceps, we're going to lay face down on the roller. I bring my opposite leg out to the side, so you can see from here, I would bring this leg here as I roll. That just helps me to move easier along the foam roller. So I have my right leg out to the side, left leg is on the roller, and I'm just going to slowly go back and forth. Looking for tight spots, I'll rotate my leg in and out. So here I'm working more medially. Then right up and down the front, there's a tight spot right there, so I'm going to just pause there for a few seconds and allow that to loosen up. When I feel it start to give, start to relax, then I'll continue rolling. And I'm going to rotate my foot in also so I can get more of the lateral quadricep. And that's typically pretty tight. There's another spot, so I'll just pause there and continue on. So because I'm tall, I like to do top half, bottom half. So I only go down to mid thigh, and I make sure I get everything there. You can also roll the entire distance from the knee, and for people who aren't quite as tall as I am, this works just fine, where I'll roll all the way from the knee to the hip in one long motion. And that works fine as well. So either way is great. Taller people, a lot of times it's easier just to go top half, bottom half. And right along the middle will also be a pretty tight area most of the time. That is the femoral band of fascia. It's a thicker band of fascia, so it binds up easier. Another way that I can intensify this, and probably you won't need to initially, but another thing that I can do is I can find the tight spot, there's one right there, and then I can incorporate movement. So I'm going to flex the knee and extend the knee while pinning down that tight spot. And it's just going to get in a little bit deeper. It's going to incorporate movement, which I like. I want to make sure that I keep everything aligned as I move, because the idea behind the foam rolling is just to improve movement and alignment of the joints. So as I'm moving, I find a tight spot. I want to align everything, make sure I'm moving in the path, the joint's moving in the path that I want it to move in, and I'll take it through that range of motion. And I'll just spend a couple of minutes each leg, and honestly, you should feel immediately better. So, or different at least, typically better, but looser, lighter, should move better. And it's crazy how much just a couple minutes on the foam roller will actually make a difference. So you should give it a shot if you haven't. If it's really painful initially, you can hold your weight up a little bit and just put as much pressure on as you like. But you want a little bit of discomfort. You're trying to break stuff up that doesn't want to be broken up. You have to take a little bit of pressure and a little discomfort to feel better in the long run. The great thing about foam rolling is as we improve the tissue quality, it won't hurt as bad. So the next time I roll, it's not going to be as uncomfortable as it was now. If you roll consistently, it doesn't even have to hurt. But initially, someone who needs it and has not been rolling, there's a good tight spot right there. I'm just going to pause there. Someone who needs to roll that really is bound up, it's going to be fairly painful initially. And they make different density foam rollers as well. So you can start out soft and then go something a little more aggressive. And there's even more aggressive options after that for someone who's been at it a while. But that's it. So great for treatment of lower back pain and also knee pain. So this is the first thing we tell people to do when they come to us with knee pain or back pain. We ask them, have you been foam rolling? And typically they say no. We'll say, well, try that for a couple days and let me know what you think. See if that changes anything. Or you can also get in to see a therapist. It's the other thing we do, obviously, is I work on people and we can do the same thing and to a better degree. So, but not everybody can see a therapist all the time. So massage therapy, self-myofascial release, which is self-massage, both great for loosening up the hip flexors and quadriceps and treating knee pain and lower back pain. And again, obviously, it depends what the problem is. If there's some underlying issue that isn't going to be resolved through that, then it's not. But it's good to try. And it's a quick, easy thing to rule out whether or not this will help with my back or knee pain. So give it a shot and let us know what you think.